Mrs. Cope?
Yes.
Hello. My name is Sophia and I'm going to be performing your assessment today. Is that okay?
Yep.
All right, so what we're going to do right away is start with a weight and a height. So I'll have you stand up. Patient already took her shoes off, so we'll start with that. And I'll have you step on the scale. All right, and then I'll have you come over here. Put your feet all the way to the back as much as you can. All right, you can step out. And well, right at 165. All right, then I'll have you sit down and we'll grab your vitals here.
Okay.
How are you feeling today? Good. Looks like we're just in here for an annual exam.
Yep.
All right. So I'm going to get your pulse and oxygen here. And do a temperature. Temperature is 98.9. Your oxygen is at 99 and your pulse is 89 today. So they're all within normal range. And then we'll get a blood pressure.
Okay.
Make sure that it is a appropriate size for the patient. Put it on. All right, and then I would make sure that she is sitting flat with her feet flat on the floor. She's sitting up and her arm is rested. Great. And then I will listen with the diaphragm of my stethoscope. Okay, blood pressure was 118/66. So looking good there and within range. Alright. So now that we are done with our vitals, I'm going to have you stand up and we're going to have you sit there to do the assessment. So even as she walks, I can assess her gait and she is stable, no balance issues, and she was able to ambulate herself over here. I'm going to move you up a little bit. Get her to a height appropriate for myself and for her, and I'm going to bring this up a little. So the first thing I'm going to start with is just inspecting. So I'm going to be looking at her skin, and also I can note that she is aware to person, place, and time. She was able to give information for herself, and yeah. And so now I'm going to start by just looking at her general appearance. She has pink skin. You can see the flush in her cheeks. And she's looking good there. And so what I'm going to start with is her peripheral vascular assessment. And so what I'm going to do is I'm going to have you put out your hands, and I'm going to have her push down and then push up against resistance. And she is able to push against resistance, so there's strength there. And then I'm going to have her squeeze my fingers. All right, there's equal strength on each side. And then I'm going to check her I'll get it. Oh gosh. I'm blanking, say it.
Capillary refill.
Capillary refill. Okay, do it again. Checking capillary refill. and it is under 2 seconds, so we're looking good there. And then can I take a look at your arms?
Mm-hmm.
Okay, I'm going to roll up her sleeves, and I'm gonna look on this side. And I'm just checking to make sure her skin looks good. She has good skin integrity. Check for any moles. So we're looking good there. Skin is pink. And then I'm going to check her radial pulses while I'm here. All right, and they are both strong and equal, 2+. And then I'm going to check her brachial pulse too. Same, 2+. All right. And next we're going to go to your neck, all right? So what I'm going to do again is start with inspection. So I'm going to look and make sure there's no bulging or lesions. And then I'm going to have you tip your head back. We're going to check your trachea. So I'm checking to see if it's deviated to one side, but it is straight in line. There's no bulging where her thyroid is. And so that's good. I'll have you put your neck down. And then next thing I'm going to do is auscultate and listen. Yes, I'm going to auscultate and listen near her jugular veins. And so what I'm going to do is listen for a bruit. And so what we're going to do is have you look up to this side. And while she's doing that, I can see if there's any bulging. So there is no jugular vein distension. I'll have you do it on the other side too. So put your neck down, look that side, no bulging there. All right. And so I'm going to have you look up, and I'm going to have you take a deep breath in and out and hold it. And I'm listening with the bell of my stethoscope. And we're listening for a swishing sound for the presence of a bruit. And there was none on that side, and we'll have you do that side in and out. Hold. All right, down there. All right, and then while we're down here, I'm going to just assess your cranial nerve 11, which is going to show me her accessory muscles. And so I'm going to have you push up against. All right, she can shrug, and then I'm going to have you turn side to side and up and down. All right, so cranial nerve 11 is intact. And then we're going to move to her heart sounds. Actually, I'm going to feel. So palpation, that's the last step. So we're going to feel for any lumps, bumps, and I want you to tell me if there's any tenderness while I'm doing this. Okay, I'm just going to warm up my hands a little bit. I'm going to feel up here. Tenderness, aching, all right, and I'm feeling the lymph nodes, and there is no palpable lumps or bumps or abnormalities there. And so then I'm going to move to the heart. And what we're going to do is we're going to listen to the 5 heart sounds, the aortic, pulmonic, Erb's point, and tricuspid, and mitral, which is the apical pulse. All right. So I'll have you just breathe normal. I'm going to listen with the diaphragm of my stethoscope. Right. I'm just going to go under here. All right. And then if I were going to get the apical pulse, I would listen down there for a full minute and record that. Next, we're going to go to the chest examination. And the first thing I'll start with is inspection again. And so what I'm looking at is her chest rising and falling? Is she using any of her accessory muscles to breathe? And she's not, so she's looking good there. I do know that the patient has asthma, so when I'm listening, I will make sure to listen for any wheezing, which is present with asthma. And then, of course, any other sounds such as crackling or stridor or things like that, but we'll note that during the assessment. So I'm looking. I'll go to her back for the inspection, again, making sure she's not using any extra muscles to breathe. It's looking normal. And then I'm checking the width for barrel chest, because that is seen in patients with COPD, and I see the normal width there, so that's good. Next, I'm going to auscultate, and I'm going to listen at the 12-point breath sounds on the back and the front. So when I do this, I'm going to have you breathe in and out, and we'll check each side just to make sure we get a good breath and listen.
Okay.
So we'll start here. Okay. And then, okay, we're sounding good there. Again, in the back. There we go. And I'm going in a zigzag here. Making sure the breaths are clear. They are back here. And then make sure to wrap around her rib cage. And last one here. All right. And then that is it for today's assessment.
Excellent, thank you.
Thank you.